ఇక్కడ సౌండ్ చేయొద్దు, లైవ్ ఉన్నాను. సౌండ్ చేయదు, లైవ్ అవుతున్నాను. ఫ్యాన్ సౌండ్ చేయదు. ఇక్కడ డిస్టర్బ్ మాట్లాడు. A very good morning to all of you. Happy morning. Let us begin with the questions one by one. Let's jump in. Fox-Fordyce disease effects. Now, what is Fox-Fordyce disease? Fox-Fordyce disease is also called apocrine miliaria. Apocrine miliaria. It is a rare chronic inflammatory skin disease affecting the apocrine glands. Now, where are apocrine glands present? Apocrine glands are present in axilla, areola, and anogenital region. How does it present? Fox-Fordyce disease. Fox-Fordyce disease presents as a pruritic. It is extremely pruritic. Papular. Papules are there, and eruption is there. Pruritic papular eruptions, PPE. So Fox-Fordyce disease affects the apocrine gland. Let us look into the options. Fox-Fordyce disease affects A. Sebaceous gland, B. Eccrine glands, C. Apocrine glands, and D. Any gland. Let us look what the correct option here is. The correct option here is apocrine glands. So Fox-Fordyce disease affects the apocrine glands. It is a rare chronic inflammatory skin disease affecting the apocrine glands. Apocrine glands are present in the axilla, areola, and the anogenital region. Let's move on to the next question. Which of the following is the most common form of malignant melanoma? Again, this malignant melanoma is a very important topic. At least one or two questions are expected in the NEET PG and the next exam. So let us look which is the most common form of malignant melanoma. Now, what are the different types of malignant melanoma? Can anybody comment in the chat box? Types of malignant melanoma. The different types of malignant melanoma are superficial spreading melanoma, nodular melanoma, lentigo maligna melanoma, acral lentiginous melanoma, superficial spreading melanoma, nodular melanoma, lentigo maligna melanoma, acral lentiginous melanoma, and amelanotic melanoma. Among these forms, superficial spreading is the most common form of malignant melanoma. Let us look what the options are given. A. Nodular, B. Superficial spreading, C. Acral lentiginous, D. Mucosal. Let us look what the correct answer here is. The correct answer here is B. Superficial spreading malignant melanoma. So most common form of malignant melanoma is superficial spreading malignant melanoma. Lines of Blaschko. Lines of Blaschko represent A. Lines along the lymphatics. Lines along the lymphatics. B. Lines along the blood vessels. C. Lines along the nerves. And D. Lines of development. Do you remember what lines of Blaschko are? If you remember, type in the comment box what lines of Blaschko are. You must have studied it in your first year regarding lines of Blaschko in embryology part. So the lines of Blaschko are a pattern of lines on the skin that represent the developmental growth pattern during the epidermal cell migration. They do not represent vascular, lymphatic, or nervous structures. So options A, B, C are out. So what remains is the lines of development. So let us look what the correct option here is. So lines of Blaschko represent the lines of development. So lines of Blaschko represent the lines of development. They do not represent any lymphatic, vascular or nerves. So the correct option here is D, lines of development. Pemphigus vulgaris is characterized by all. Pemphigus vulgaris is characterized by all. Now this Pemphigus vulgaris is a very important topic in dermatology. What exactly is Pemphigus vulgaris? Can anybody comment what exactly is Pemphigus vulgaris? You all know it very well. Please comment in the chat box. What exactly is Pemphigus vulgaris? Pemphigus vulgaris is a rare group of autoimmune disease. What does it cause? It causes blisters on the skin and mucous membrane, and it occurs throughout the body. It affects the mouth, nose, throat, eye, and genitals. Pemphigus vulgaris is the most common type of pemphigus. Pemphigus vulgaris is the most common type of pemphigus. Now, what are the different type of things that are seen in pemphigus vulgaris? So, pemphigus vulgaris is a rare chronic blistering skin disease. It is the most common form of pemphigus. It is derived from the Greek word pemphix. Pemphix means blister. And what type of hypersensitivity it is? Type 2 hypersensitivity reaction, in which the antibodies are formed against the desmosomes. Against the desmosomes. Now, what are the signs and symptoms of pemphigus vulgaris? There are blisters all around the body, in the skin and the mucous membrane, the conjunctiva, the nose, the esophagus, the penis, the vulva, vagina, cervix, and anus. The blisters are flaccid. Flaccid. The skin of palm and soles is spared. Once the blisters break, they leave ulcerated lesions and erosions. Here, there is a positive Nikolsky sign is there. Positive Nikolsky sign is there. There is severe pain is there. Oral erosions are there. So pemphigus is an autoimmune disease. Antibodies are directed against both desmoglein 1 and desmoglein 3 present in the desmosomes. Antibodies are directed against both desmoglein 1 and desmoglein 3. Loss of desmosomes are there, so there is loss of cohesion between the keratinocytes in the epidermis. and the disruption in barrier function served by intact skin. It is classified as type 2 hypersensitivity reaction. Type 2 hypersensitivity reaction. Nikolsky sign is positive. Nikolsky sign is positive. The disease most commonly affects in middle-aged or older people, usually starting with a blister that ruptures easily. Now, how do you diagnose it? Positive Nikolsky sign is there. Then you can do a Zank smear. You can do a Zank smear. On Zank smear, you can see a rounded nucleated keratinocyte formed due to antibody-mediated damage to cell adhesion molecule. So, in pemphigus vulgaris, there is no subepidermal bulla. It is an intraepidermal bulla. So, the correct option here is C. Let us look what exactly the correct option is. It is C. So, pemphigus vulgaris is characterized by positive Nikolsky sign, oral erosions. Jank smear shows acantholytic cells. The only out of the box thing is subepidermal bulla. All are features of atopic dermatitis. All are features of atopic dermatitis. Now let us look what exactly is atopic dermatitis. Can you type in the chat box this highly important, very high yielding topic called atopic dermatitis? Atopic dermatitis. Atopic dermatitis is a very common disease in infants. So, what exactly is atopic dermatitis? Please type in the chat box. What is atopic dermatitis? Atopic dermatitis, it is also called atopic eczema. It is a long term, means chronic type of inflammation of skin. Dermatitis means inflammation of skin. So it results in itchy, red, swollen, and cracked skin. Itchy, red, swollen, and cracked skin. Clear fluid may come from affected areas. Clear fluid may come from affected areas, which can thicken over time. It can also be called simply as eczema, but eczema is a larger group of skin conditions. Atopic dermatitis affects about 20% of people. Such a common condition. It can occur at any age, but it typically starts in childhood with changing severity over the year. Huh? So, atopic dermatitis, four options have been given: Denny Morgan code, Hartog sign, hyperlinearity of palms, Darius. So, atopic dermatitis starts early in childhood with changing severity over the years. Face and limbs and much of the body is affected. The areas of inside of knees and folds of elbows and around the neck are most commonly affected. In adults, hands and feet are commonly affected. Scratching affects the worsens the eczema and increases the risk of skin infections. Some of them may develop asthma also. The cause is unknown but is believed to involve genetics, immune system dysfunction, and environmental exposure. If one of the identical twin is affected, then the other has 85% of chance of having the condition. Those who live in cities and dry climate are commonly affected. Frequent hand washing makes the symptoms worse. Emotional stress can make the symptom worse, but it is not a cause. This disorder is not contagious. Signs, symptoms, and family history make the diagnosis easy. You can give corticosteroids, calcineurin inhibitors, tacrolimus, pimecrolimus, antihistamine pills may help with the itches. Phototherapy may be useful in some people. Antibiotics are usually are not helpful unless there is secondary bacterial infection. Cyclosporin, methotrexate, dupilumab, baricitinib can be given. The other names of atopic dermatitis is infantile eczema, flexular eczema, prurigo Balsnier's allergic eczema. The signs and symptoms are scaling, cracking, that is fissures, swelling, edema, bumpiness, papillation, oozing of a clear fluid, thickening of skin, also called lichenification, are seen. Skin swelling is known Denny Morgan infraorbital folds. Denny Morgan infraorbital folds. So the option is Darrier sign. Darrier sign is seen in Urticaria pigmentosa, whereas Denny Morgan fold Hartog sign, hyperlinearity of palms is seen in atopic dermatitis. Let us see what the correct option here is. Darrier sign. Koebner phenomenon is seen in, well, Koebner phenomenon. What is Koebner phenomenon? A very exciting thing it is, Koebner phenomenon. A. Psoriasis, B. Lichen planus, wart, and D. All of the above. Now let us look what is Koebner phenomenon. Koebner phenomenon is also called isomorphic response, based on the name of the scientist Heinrich Koebner. It is appearance of skin lesions along the line of trauma. So Koebner's phenomenon is seen in vitiligo, psoriasis, lichen planus, pityriasis rubra pilaris, keratosis follicularis. So Koebner's phenomenon is seen in psoriasis, pityriasis rubra pilaris, lichen planus, flat warts, lichen nitidus, vitiligo, lichen sclerosis, elastosis perforans serpinginosa, kaposis sarcoma, necrobiosis lipoidica, lupus, juvenile idiopathic arthritis, Still's disease, cutaneous leishmaniasis, post-Kala-Azar dermal leishmaniasis, eruptive xanthomas, psoriasis, pityriasis rubra pilaris, lichen planus, warts, lichen nitidus, vitiligo, lichen sclerosis, elastosis perforans serpinginosa, Kaposis sarcoma, necrobiosis lipoidica, lupus, juvenile idiopathic arthritis, Still's disease, cutaneous leishmaniasis, post-Kala-Azar dermal leishmaniasis, eruptive xanthomas. So Koebner's phenomenon is seen in all of the above. So let us look what the correct option here is. Heliopter sign is seen in This heliopter sign is seen in dermatomyositis. Let us, they have given the four options: A. Dermatomyositis, B. Scleroderma, C. Photodermatitis, D. Vitiligo. The correct option here is A. Dermatomyositis. Erythema is caused by A. Corynebacterium, B. Staphylococcus, C. Streptococcus, D. Herpes virus. Now let us look what erythema is. Erythema. Erythema. Erythema is a superficial skin infection that causes brown scaly skin patches. Erythema is caused by Corynebacterium minitusimum. Minitusimum, a bacteria which is a normal part of skin flora. It is normally present on the skin. It can be generalized erythema or an interdigital erythema. Erythema. The signs and symptoms of erythema are initially pink but progress quickly to become brown and brown and scaly. Erythema patches are typically found in moist and interteginous area, that is, armpit, groin, underbreast. Can be well-defined patches or irregular. The most common is interdigital erythema, present as scaling, fissuring on chronic, non-resolving breakdown of toe, the slightly webbed spaces. Cause erythema is caused by Corynebacterium minitusimum, moist and warm environments. It can be due to poor hygiene, obesity, poorly functioning immune system. The differential diagnosis of erythema is psoriasis, candidiasis, dermatophytosis, and intertrigo. Simple syndrome investigation wood slam causes coral red color. Coral red color. Tinea versicolor will appear as copper orange color, whereas this erythema will appear as coral red color. So let us look at the options: A. Corynebacterium, B. Staphylococcus, C. Streptococcus, D. Herpes. So erythema is caused by Corynebacterium minitusimum. So the correct option here is Corynebacterium. Christmas tree appearance in skin is seen in A. Pityriasis rosea, Pityriasis rubra pilaris, psoriasis, vitiligo. Christmas tree appearance in skin is seen in, as we know, it is Pityriasis rosea. So the correct option here is A. Pityriasis rosea. Pomphilox. Pomphilox affects A. Palm and sole, B. Groin, C. Scalp, D. Trunk. Pomphilox affects the palm and soles. HPV causes, we all know it causes condyloma lata. So the correct option here is A. Condyloma lata. Nail pitting is seen in, yes, A. Paronychia, B. Ectodermal dysplasia, C. Alopecia areata, D. All of the above. So nail pitting is seen in all of the above: paronychia, ectodermal dysplasia, alopecia areata. So the correct option here is D. All of the above. Vitiligo is associated with all of the following: Vitiligo is a chronic autoimmune disorder. Chronic autoimmune disorder. So, what are the different conditions in which vitiligo occur? Vitiligo can occur in scleroderma, rheumatoid arthritis, psoriasis, diabetes, type 1 diabetes mellitus, Addison's disease, pernicious anemia, alopecia areata, systemic lupus erythematosus, celiac disease. Celiac disease. So vitiligo is associated with all of the following: Addison's disease, Men's syndrome, pernicious anemia, except it is Crohn's disease. So the inflammatory products are caspase 1 and caspase 7, which activate the inflammatory cytokine interleukin 1b. Interleukin 1b and interleukin 18 are expressed at higher levels in people with vitiligo. Interleukin 1b and interleukin 18 are expressed in high level in people with vitiligo. There is a mutation in amino acid leucine in NALP1 protein where it is replaced by histidine. So leucine 155 is replaced by histidine. The original protein and sequence is highly conserved in evolution. Found in. How do you diagnose this condition? An ultraviolet light can be used in early phase of disease for identification and to determine the effectiveness of treatment. Using a wood light, skin will change in color, fluorescent, when it is affected by certain bacteria, fungi, and changes in pigmentation of skin. So the correct option here is except it is Crohn's disease. D. So vitiligo is associated with Addison's disease, Men's syndrome, pernicious anemia, except Crohn's disease. Hashiban cells in epidermis. Hashiban cells, the other name is Merkel cells. They are responsible for A. Touch, B. Temperature, C. Pressure, D. Proprioception. Hashiban cells in epidermis are responsible for touch. Apple jelly nodule are seen in. Apple jelly nodule is seen in lupus. A. Lupus vulgaris. B. Cutaneous anaphylaxis. C. Erythroderma. D. Erysipelas. Erysipelas. Apple jelly nodule are seen in lupus vulgaris. So now, what is lupus vulgaris? Lupus vulgaris, are also known as tuberculosis luposa, is a painful. It is a painful cutaneous tuberculous skin lesion with nodular appearance, most often on the face, around the nose, eyelids, lips, cheeks, and ears and neck. Most common Mycobacteria tuberculosis skin infection. If it is left untreated, it will become disfiguring ulcers. It begins as painless reddish brown nodule, which slowly enlarges to form irregularly shaped red plaque. Lupus vulgaris changes within skin in hyperkeratotic forms. Lupus vulgaris is often develops to inadequately treated pre-existing tuberculosis. It may also develop at the site of BCG vaccine. Rarely, lupus vulgaris may be associated with tattoo marks. Histopathology, it shows presence of epithelioid cell granulomas with Langerhans giant cells with or without central caseation necrosis in dermis. Diagnosis, do diascopy, it shows characteristic apple jelly color. Biopsy will reveal a tuberculoid granuloma with few bacilli. Mantoux test is positive. Now, what are the different shell diagnoses of lupus vulgaris? Basal cell carcinoma, sarcoidosis, leprosy, deep fungal infection. So, apple jelly nodule is seen in A. Lupus vulgaris. True about lesions of lichen planus. Lichen planus. A. Polygonal violaceous papule. B. Affect skin and mucous membrane. C. Are pruritic. D. All of the above. Now let us look what exactly is lichen planus. What exactly is lichen planus? Lichen planus is a chronic inflammatory autoimmune disease that affects the skin, hair, nail, and mucous membrane. It is characterized by polygonal, flat-topped, violaceous papules affecting skin and mucous membrane. There are fine white, reticulated fine white scales, which are known as Wickham striae. Commonly affects dorsal hands, flexular wrists, and forearms. So this is about lichen planus. So they are polygonal, violaceous papule, affect skin and mucous membrane, are pruritic. Correct option is D, all the above. Color of tuberculous sclerosis lesion on wood lamp examination is, it is blue white. Alopecia areata is, we all know it is an autoimmune disorder. A. Autoimmune disorder, B. Allergic disorder, C. Anaphylactic disorder, D. Bacterial infection. It is autoimmune disorder. Whitefield's ointment, we all know it is 3% cyclic acid and 6% benzoic acid. So the correct option here is A. Urinary retention earliest in pregnancy is seen at 10 weeks. Spaghetti and meatball appearance is seen in A. Pityriasis rosea, B. Tinea capitis, C. Tinea corporis, D. Tinea versicolor. It is seen in Tinea versicolor, D. Miliaria arises from obstruction of eccrine sweat glands, A. Black pydra is seen in caused by Pydria horti. Onychomycosis is most commonly caused by A. Trichophyton rubron, B. Trichophyton mentagrophytes, Epidermophyton flocosum, D. Candida. It is Trichophyton rubron. RAS test is used in diagnosis of A. Allergic dermatitis, B. Seborrheic dermatitis, C. Mycosis fungoides, D. Squamous cell carcinoma. It is A. Allergic dermatitis.